Yep, mesial and distal would be the surfaces. So whenever the doctor is working on the patient and all of a sudden they're like, okay, it might be on schedule already, it's planned for it to be a class 2, not class 2, excuse me, an interproximal cavity. But it might be an occlusal, and then it turns into it because the decay started running over too close to one of the walls. So they'll ask for, okay, it's starting to go to the interproximal areas, we need a Toffel-Meyer matrix. So what they're asking for are these things right here. So typically, if it's on schedule and you know that you're going to use it or need it, you wouldn't set up all of these things like that. It's kind of just depending on what tooth it is or what kind of patient it is. So I'm just going to show you really quick what each one is. This one here is the standard matrix band, and this is what is going to be used to wrap around the tooth. Okay, this is a number 1. They'll never ask for a number 1. They'll just say I need a matrix, and usually they're talking about this. This one is a pedo matrix, and you can tell the difference between the two because of the size. This is a lot shorter and a lot thinner, and then it has these little round notches on here. They will use this on an adult tooth sometimes, not often. It just depends on the shape of the tooth and how the tooth is curving or whatever. But they'll ask for this specifically if they're working for an adult tooth. But if it's a child, they're going to pretty much expect you just to pull this one out, okay? And then this one, I learned it as called the dolly band. And it's because it has boobs, like Dolly Parton. That's how we learned it in school, and I've heard other doctors call it that too, so I just took it that everyone calls it a dolly band, okay? So they use this when the interproximal walls go really, really deep, and it starts to get underneath the gingival sulcus, so down into the margin area. So they need to get really, really down underneath there, and this one doesn't cut it close. So this one allows it to go a little bit further down, so that way they can get the filling to be really, really flush with the margins, okay? These are the Toffel-Meyers, which is the guide that's going to hold the matrix. To activate them or use them, not like with any special powers or anything, you untwist it here. You twist it up to tighten it, and then you twist it this way to loosen it. So just as an introduction to show you how it all works, and that kind of slides down, and then I'll show you how to build it in just a moment. Okay, these are, they also have Toffel-Meyers that are pedo size too, but I've seen a lot of doctors still just use the regular size Toffel-Meyers for pedo bands. They can work with either one. That's why they have these little round notches on the end, because then that way it can still fit into that area. These are the wedges. These wedges here go interproximally. It goes down by where the gum is. They're shaped pretty much like a triangle once it's placed inside of the tooth area. This part sits flat against the gum, so if it's a lower tooth, it would go in this way. If it's an upper tooth, it would go in this way. And the reason why it is shaped like a triangle on the top is so that you can have the contour of the shape look how normal teeth look. So it's kind of has a triangular shape. So as we get ready to learn more about morphology, then you'll learn what that area is called. Okay, so where the contacts of the teeth meet, that little space in between is kind of a triangular shape. There's different sizes, different lengths, different thicknesses. They have the slim gems, they have the thick wide ones, they have the short fatties, you know, whatever the doctor is used to calling it and asking for, you'll kind of get used to it. I'm not going to be particular into which kind you use. I just want to see that you know how to place it and know how to remove it when it's time. Any questions so far?
Is that just like wood?
Yep, just a piece of wood, look kind of like a toothpick. Kind of like a little piece of toothpick. They have the plastic ones too, when you have to do a clear plastic matrix, which is for the anterior teeth. We'll talk about that another time. But that will help you to cure the material since everything's clear, so that way that blue light, when you're shining through it, will go straight through both the wedge and the plastic matrix. So pretty much the instruments that you need when placing the Toffel-Meyers, you need your basic kit, or if you're doing a restorative procedure, then of course you need your restorative kit. Restorative being composite or amalgam. So you'll have that set up there as well. You need an additional, what is that? Okay. This is a condenser. Tricked you. So you'll need a condenser as well. And then you'll need a plastic instrument or a packing instrument. And we'll talk about why and when you'll use those there. Okay. So now what I'll have you do is come around this way so we can see. Oh, let me build it for you, I guess. Sorry. I lied. Let me build it for you. So when working with your Toffelmeyer matrix, depending on what side you're working with. You want to start, and we'll just use it with the standard for now. I usually always start it with my mountain down. I call it a mountain. Instead of having it up this way and climbing the mountain, I'm kind of going down the hills and skiing downwards, okay? Mountain down, and then I kind of roll it. You don't want to bend it in the middle here, because then that's going to cause the filling to be kind of pointed. So you want to kind of just lightly curve it that way. Line them up as best as possible. And then what I do is I slide them into, I call these roots. All the things that we've kind of learned, or I'll say to you, is things that my instructor taught me many moons ago. So it just stuck with me and helped me to remember how to do it. So I keep my roots pointed upwards, so pretending I'm working on a maxillary tooth, so my roots are going up, okay? So I load it in here. There's little slits right here in between. You kind of place it in between the roots and then go right into where those slits are. And then start to screw this in here. And you don't want to go super, super tight quite yet, because this is just the universal setup for it. So depending on if you're working on an upper right tooth, an upper left, lower right, or lower left, you're going to actually start to curve this in between the roots, okay? So universal setup is straight this way. So if we are going to work on, let's say, an upper right tooth, so what tooth do I have open over here? It's tooth number 3. Then I would loosen it up a little bit here, and I would curve it so that it's going to go to my patient left, and then I would tighten it. So if I place it into the mouth, it's going over to the left side. And then this is the way I would start to place it, okay? The cool thing about it is when you curve it to your left, when you flip it this way, it's going to work for the opposite side on the lower left. So you don't have to change it if you're working on the upper right and lower left. It'll work for upper right or lower left. So that tells you that if we're doing an upper left, it will work for what side? Lower right. So basically when I show you how to set that up, it just will flip over either one. So if doctor's like, oh, okay, we're working on tooth number 30, and you, oh my gosh, on which side? Oh, I'm just going to set it up for the upper left. It's going to automatically go right where it needs to go for the lower right side. Okay, so before you get to placing it, that's when you start to tighten it a little bit so that it's in there nice and secure. I usually take, I have my PPE on. So I usually will take my shepherd's hook, and I kind of take my finger here and curve it some for me so that I can make it a little bit wider. And you want to do it without having to bend the edges here. And then sometimes you might have to, if you want to make it tighter or smaller, you roll this one here. So to open it is this bottom one, and to make the size of the band, can you see it shrinking? Mm-hmm. Smaller or larger, you roll this longer tube here. Okay, so I usually kind of start it with it being fairly big. That way I can get it around the tooth. And I kind of just soften it up and curve it around this way. Okay. And so you'll probably want to come on this side so you can see what I'm doing. If you are to look into Toby's mouth, you'll see that what surfaces are we going to be working on tooth number 3? What surfaces? Look at it. What surface filling are we doing on number 3? Look at the tooth. It's carved out. What surfaces are we working? An MO or just a DO?
Just a DO.
Just a DO. So the MO is not taken out. However, if we were working on an MOD, you would still use the band. Remember, it's never going to be just an occlusal when using your Toffelmeyer. You don't need it for it because the walls are already in place. It's always an interproximal type of filling that you need to do. It involves the walls of the tooth. Okay, so we're doing a DO on tooth number 3. So this is a job of an expanded functions dental assistant in Washington State. the dental assistants can place it. Doctors will place it sometimes if they're moving super fast, but usually after he's carved it out and he's allowed it to dry and he's placed the different materials in it for whatever filling he's using, he'll get up and go do an exam, and you're going to be the one that places this wedge in the top premolar. So what you do first, I usually just kind of come around to the lingual, so then that way I can start to get it around the tooth, and then you place it around just like that. Before I start doing anything else, while I'm holding it in place, I look to see and make sure that it's underneath the gum tissue so that there's no moisture getting in there. When you get ready to tighten everything, because you want everything to fit nice and snug, you hold it here with your finger because you don't want it to start to move, and then you might have to kind of retract their tongue or their cheek right here. Or you might need to take your finger on this side and block the cheek for them, because you don't want to start twisting it and then it catches the lip. Okay, so usually I kind of pull up with my thumb here and I start to twist, and I don't go super tight. I go to right where I can feel it kind of squeezing a little bit, and you can tell because when you're twisting it, it kind of stops moving as much, but you don't want to go super tight where it gets so tight that the contacts are loose and then they start getting food caught in between the teeth. So you just kind of start off there first, holding it just to secure it. Then you'll take a look inside with your mirror, making sure that, again, there's no gum tissue showing through and that everything looks pretty good. And look on the lingual side, make sure it's underneath there. You check on the buccal, make sure it's underneath there nicely. You guys want to take a peek and see how it looks in there. You don't have to record them looking.
I know, but I can't like pause it.
You just put 2 videos up.
Stop it.